Now let's take a closer look at animal-assisted interventions with our panel of experts. Today we're joined by Ashley Kalosieh, Patricia E. Kelly, and Dr. Brian Ogle. Ashley Kalosieh is the founder and owner of SpeechPath LLC, a speech and language therapy practice in Farmington, Connecticut. Since receiving a certificate from the University of Denver in animal-assisted therapy, she now specializes in AAT as a therapeutic method for her clients with learning and processing disorders who benefit from working with animals to achieve their individual goals. She received her bachelor's degree from Boston College and her master's degree from the University of Connecticut. Patricia E. Kelly is a former U.S. Marine and equestrian trailblazer who has been at the helm of the Hartford, Connecticut-based nonprofit organization, Ebony Horsewomen, Incorporated, for the past 36 years, which now operates as an equestrian and therapeutic organization and is a leader in the field of culturally competent services providing equine-assisted therapy and psychotherapy. Kelly, who has been inducted into the National Multicultural Western Heritage Museum and Hall of Fame and the National Cowgirl Museum and Hall of Fame, was named a CNN Top 10 Hero and is a trained equestrian instructor, certified urban riding instructor, and is certified in equine-assisted growth, learning, and therapy as a horse specialist. Dr. Brian Ogle is an assistant professor of anthrozoology with specialties in zoos, aquariums, animal shelters, human-wildlife conflict, and pet animal ownership at Beacon College. He is an education advisor to the Association of Zoos and Aquariums, Philae Taxon Advisory Group, a former executive member at large for the Association of Professional Humane Educators, and a board member for the Humane Education Coalition. He served as a program director at the Smithsonian Conservation Biology Institute. Ogle earned his bachelor's degree in adult education with an emphasis on biology from Bellevue University, his master's degree in anthrozoology from Canisius College, and his doctorate in curriculum and instruction from the University of Central Florida. Joining me in studio is Dr. Brian Ogle.
Hello.
Welcome aboard, Brian.
Thank you.
So our first question today is, animal-assisted intervention carries a broad umbrella. What qualifies?
So it does carry a broad umbrella, right? We talk about interventions that could be social, cognitive, emotional, they could be education-driven. Really, at the end of the day, what really defines all of these together is that it's goal-directed and it's a planned intervention to achieve that goal using an animal as that vehicle to deliver whatever therapy has been described or prescribed by the practitioner.
Okay, thank you.
Mm-hmm.
Our next question goes to Ashley. Ashley, in what scenarios is animal-assisted therapy used?
Many age and different needs can certainly benefit. I typically embed AAT as a tool in my speech and language therapy with ages, preschool through young adults with social communication challenges. And that usually includes clients with autism spectrum disorder, social pragmatic communication disorder, among others. And then just some kids and clients who are just more motivated by the presence of an animal.
So this question is to you, Patricia. Who can benefit from animal-assisted intervention?
Animal intervention can be useful for almost anyone, but we have to depict what that means, animal intervention. So at our facility, there are two kinds of therapy that we use. One is called equine-assisted therapy and equine-assisted psychotherapy. Equine-assisted therapy is generally any kind of activity that involves a horse. Could be riding a horse, unmounted activities, grooming, tacking, walking, that kind of thing. Equine-assisted psychotherapy is always delivered by, hopefully, a culturally competent, licensed therapist, along with a horse specialist, and of course, a horse and a client. So equine-assisted therapy, the generalization of it all, can be useful to almost anyone. It works great with people who have a lot of anxiety and stress, but those individuals who are suffering from a deeper type of trauma could really benefit from equine-assisted psychotherapy.
So, Dr. Ogle, how are animals selected for use in animal intervention?
So it's not an easy kind of a one size fits all, right? So typically what the animal or what the trainer is looking for is an animal that has a well-rounded temperament and personality in which the animal is going to be able to handle stress, anxiety, being around humans for a prolonged period of time, and then also just be able to have a good relationship with the handler. And that's a critical component because there needs to be that trust that exists between the animal and the handler. There's also not just one type of animal that works for animal-assisted therapy either. Dogs and horses are kind of the easy go-to ones, but we've seen pigs, we've seen guinea pigs, chickens, llamas, alpacas, you name it, and it's been used in animal-assisted therapy at some point in time.
Thank you. Ashley, how do you incorporate therapy dogs in speech and language therapy?
So I carefully choose my clients who would benefit from AAT. I'm a traditional speech language pathologist. I do typical articulation therapy and things like that. But for AAT, I do carefully choose which clients would benefit from that. A lot of people will seek me out based on my specialization in AAT as part of what I do. Not everyone would be motivated or would be a good candidate, for AAT for several different reasons. I choose, registered therapy teams based on the dog, based on the client, their personality, their needs, their sizes. We do lots of different things in therapy. We play games, we take turns, we work on a lot of social language, pragmatic language, goals, initiating, perspective taking, requesting, using verbal, nonverbal language. What does it mean for the dog versus a person? Things like that. So it's typically part of a therapy plan, a treatment plan, to target goals, as animal-assisted therapy is really specific and tied to goals. It's driven. It's not just like animal-assisted activities or animal-assisted interventions, which are more general, the READ programs in the libraries, or people who just kind of visit patients in a hospital casually. Like mine is really tied to their treatment plan, to their specific goals. And that's what makes AAT different from, animal-assisted activities.
Next question, Patricia, likewise, can you describe the process of using horses during equine therapy?
So when a child is presented for equine-assisted psychotherapy, generally there's an intake done beforehand. The therapist gets a fair amount of information from the parent and or other doctors who may have seen the child. Once that intake is done and the therapist has a decent amount of information, the next step is to introduce the child to a horse. Now, at our facility, we have 18 horses. And generally, but not always, a child will have an affinity towards a particular horse. The horse specialist then brings that horse out to see if there is a true connection, maybe not from the horse to the client, the child, but certainly from the child to the horse. And then we begin to start the sessions. The sessions usually last about 40 to 45 minutes, depending upon the age of the child and how long the child can sustain attention. But then interactions begin. We may walk the horse, the child may groom the horse, may be in a round pen with the horse to see what kind of levels of energy does this horse pick up, and whether or not there is anything that is not being exposed that this horse can detect, that the therapist can understand what's going on. When there is real interaction working with the horse, you can pretty much see the guardrails start to come down with this child. Things that he may not feel comfortable saying to a parent, to a therapist, he may say it to the horse. Talking in an equine-assisted psychotherapy session is never required unless the child or the client wants to do so. And at a particular point, when that level of relaxation or defensiveness reduces, then that person begins to be able to talk about what they're feeling. And that's the beginning of the process.
Well, Dr. Ogle, how does Beacon College incorporate animals in animal-assisted interventions?
Yeah, so we take more of a animal-assisted educational approach. So most of our planned kind of interventions focus on education-related goals or education initiatives that we're working on. So this can include using animals not only as a teaching partner to help the students gain confidence in being around animals or interacting with animals, but also just confidence in social interactions, confidence in their ability to read out loud, to be in a safe and a comfortable environment. Within our space, we have a variety of live animals. The primary ones that we like to use are our guinea pigs and also our rabbit that we have. The students will work with those animals, not even just in a care and a training standpoint, but they work with that animal just to develop social skills. And so they will spend time, during class or outside of class, just being with the animal, talking to the animals, socializing, and really practicing these different skills that are needed for them to really gain that confidence interacting with their peers. And it's a really cool change to see, and we see this growth and this development from the freshman year to the senior year of our students, and a lot of our students will actually contribute it to being around those animals and having that safe environment, that comfortable environment in which they feel welcomed and that they can just be themselves and really try to challenge themselves as an individual.
That was very interesting, Dr. Ogle. Thank you.
Yeah.
So Ashley, why is animal-assisted therapy effective in speech and language therapy sessions?
So there are many reasons why AAT is effective for speech language therapy. A big one is they can serve as social catalysts for social interactions. I have found, through my research as well as, during therapy, that my clients often initiate interactions more with peers and adults when an animal is present. They just feel more comfortable. They're more willing to engage with the therapist in a clinical situation as well, if a dog is there. And I usually work with therapy dogs. Dogs are also more easier to understand in terms of their verbal and nonverbal language versus people. Individuals with ASD can't always interpret or understand accurately the communication of other people. They may, but they might not as to the same degree. Where dogs just don't require that advanced social, and communication skills to be understood or to interact with them successfully. Dogs have simple, predictable behaviors that my clients more easily understand. So it's a good starting point for sure. Another reason is dogs are just judgment free, the judgment free partners in therapy. So my clients often take more of a risk when there's an animal there. They allow my clients to be more, attentive, more engaged, and more motivated in therapy, and thus they're more willing to communicate when they're more motivated by, what they're doing. I've seen more verbalizations. I've seen more on-topic initiations when a live animal is present versus, a standard therapy tool. Finally, a big reason is stress and anxiety. Oftentimes people with ASD have heightened stress and anxiety. So that's been shown to be reduced in the presence of an animal. And so they just serve as social buffers in difficult social situations.
And Patricia, animal-assisted intervention isn't like giving your child a Z-Pack for strep throat in that that once the pills are consumed, the problem is resolved. So how do parents know when the dosage, so to speak, for animal-assisted intervention has been reached?
So with like any therapy and healing begins when the client begins to understand the root of the problem. And there's no zap theory to therapy, whether it's talk therapy or otherwise. Does it go away? Hopefully not, because with every session, there may be a new revelation as to what things are, or just as important, what they are not. So there is some understanding and grappling and resolving and understanding what the issue is to some level.
back to you, Dr. Ogle. So over the past 15 years, there's been a strong interest in studying the value of including animals in educational settings and their impact in supporting the cognition, social competence, and motor development of children. My question to you is, in general, what have the findings borne out?
Yeah, so animal-assisted intervention and the research that is currently available demonstrates that the interventions are effective to a point. One of the biggest concerns we have from a research standpoint is that the interventions are so tailored to the specific situation or the specific client or even the specific environment in which they're operating in, that it's tough to translate those findings and generalize them to another situation that could be using the same type of intervention, because it really is dependent on the human aspect of things, both how it's being delivered by the handler or the therapist, but also the individuals receiving the therapy, because they're all going to be having different needs and at different points of their development. There's a lot of promising things coming out of the research, and we're hoping that they'll continue to grow and to blossom and to see more generalizable findings in the future. And there's a lot of work being done on that, and even looking at just all of the research that has been made available over the past 15 years and kind of finding the commonalities and what are these threads that all these successful interventions have in common with one another, to really define the practice and make it as valuable as possible when utilizing this type of therapy.
Thank you, sir. So the bottom line is dogs and guinea pigs, they're cute, but is there really a standard here for parents to consider using this type of intervention? Can they expect some real breakthroughs with this?
Yeah, it depends on the individual, right? It depends on the individual receiving the therapy. Just like any other treatment that may exist for cognitive or social development, and even educational initiatives, what may work for a group of people may not work for everybody, or to the same extent as it was applied across the board. In order for it to be really successful, you have to work with a therapist or a handler that truly knows the process and has been through this several times and knows what's going to work for that individual, and really setting the foundation for here's what our goals are and here's how we're going to accomplish that. It's really up to everybody as a team to communicate and to work together to figure out if this is the best intervention or what intervention may actually work better. And then how do you continue to refine it as you keep delivering that intervention, because you want the strength and the quality of the outcomes that you're seeing from the intervention to continue, not just for in the short term, but in the long term as well.
Well, thank you for that, and thank you, Dr. Ogle, Ashley Kalosieh, and Patricia E. Kelly, for joining me today and sharing your expertise on this subject of animal-assisted intervention. Do you have questions about learning differences? Are there concerns you are facing daily in your journey with learning and attention issues? We are happy to answer your questions on air. Sign up via our website, awodtv.org, to have your questions answered during our Ask the Experts segment on an upcoming episode of A World of Difference.